Well, thank you all for coming. I'm Senator Jill Tracy from the Illinois 47th District. I'm joined here today with Representative Randy Frese, who shares with me the representation of the Quincy Veterans Home and the Quincy area. And I'll let him introduce our other guest.
Thank you. I am State Representative Randy Frese. I represent the 94th District, which includes all Quincy and all of Adams County. I'd like to introduce the wonderful esteemed mayor of the city of Quincy, Kyle Moore.
Thank you. It's practice in Quincy where I have to move the mic down, so this is great to be here. I want to thank Senator Tracy and Representative Frese for inviting us here. For those who are not a part of our local media, in December we formed a bipartisan task force of current and former elected officials to get together to look at what has happened at the Veterans Home, stop the politicization of many of the comments that we saw really in late December for the Legionnaire outbreak in 2015. And what we wanted to come together as a bipartisan group is, first, we need to put the veterans first. Finger pointing is not going to get us very far. We need to look at what solutions have been done. We need to be open and transparent with any requests. We're supportive of Senator Collerton's audit. We're supportive of the bipartisan hearings that are going on here in Springfield. But also we want to pivot to what is the next generation of quality of care going to look like at the Quincy Veterans Homes? What improvements need to be made in the short term, but more importantly, what do we need to do in the long term to make sure that the future residents of the Veterans Home receive the same quality of care that they've received, past residents have received for the past 132 years. And I think today at the hearing, you saw really two different ways of tackling this. Unfortunately, you saw a few people trying to politicize this, trying to point fingers. But really, from a mayor standpoint, I was very glad to see a bipartisan approach by many of our senators and representatives to take a look at more short-term investments at the Veterans Home, but take a look at long-term needs of the Veterans Home, for an example, suggesting of building a new facility. So I was very happy to see that there were a few instances of finger-pointing and trying to bring politics into this, but from a majority standpoint, the senators and representatives that were at the hearing are putting our veterans first, taking a bipartisan approach, and that's very much the approach that we have locally here in Quincy.
Right. This is the second, as you know, of the series of hearings that will probably be held. And overall, the attitude of anyone that has visited the home, has seen the treatment of the water in place and the improvements that have been made since 2015, and have witnessed the care and service that the staff provide to our veterans, they are suddenly and overwhelmingly in support of keeping that home in the special place that it is, sitting in that 200 acres that have served veterans since the Civil War times. And so that is the positive that we see, is that once you see and understand how special it is and how they care for veterans, that they recognize that we need to continue that service to veterans. We need to take care of them the best we can right now, and then moving forward into the future, because we recognize that the veterans in Illinois are going to continue to need that throughout the different war efforts that we've had. So that's, I think, very positive, and I do see, certainly we've worked as in a steering committee fashion, in a bipartisan fashion, but also we have a good story to tell, and I think we heard from the staff today that explain how committed they are and what an honor it is to serve our veterans, something that we've known, and we're happy to share our story. And we look forward to moving on and keep bringing out everything that the public might want to know about what happened and what we're doing now to prevent it. And always we recognize that it's an unfortunate tragedy that we had an outbreak of Legionella. And I think today we heard from the Adams County Public Health that it was not necessarily isolated to within the confines of the Veterans Home. Legionella is something we're learning about more and more every day, that outbreaks do exist, and we're working to make it as safe as possible in a world that's not always perfect. So with that, I'll turn it over to Representative Frese.
Yeah, just maybe a couple additional comments. Senator had mentioned that there will be further hearings, and I have asked that one of the hearings be held at the Veterans Home in Quincy, Illinois. So perhaps, I've heard some positive feedback on that, so perhaps in the future, we may all be together again there at the state facility in Quincy. I want to thank all the state senators and the state representatives who have taken time to travel to Quincy, who serve on the veterans committees, and some are just interested parties that traveled to Quincy to tour the Veterans Home facility, to see firsthand the work that has been done, and to see what an asset that the Veterans Home is, not just for Quincy, Illinois, but for the state of Illinois. Everyone who comes and takes that tour and gets to ask questions and gets their questions answered comes away with a little bit of a different impact upon them, and a certain light is shed. And so we want to continue to offer that. I know we still have representatives and senators that want to come to Quincy to tour. We will continue to facilitate that. I thank all the administrators and staff at the Veterans Home for taking upon themselves to give our legislators a great tour and an education of the facility that we have. Looking forward to just continuing to shine that light and continuing to work on behalf of the veterans, which is why we're in it in the first place. Thank you.
With that,
So,
we'll open it to any questions.
as I understand it, the first outbreak came out in the spring of 2015?
It was more like July of 2015, late July.
2015. So the governor had a press release today saying that they're taking any number of steps to upgrade. Why is there 2.5 years gap between when these steps are being taken and when it first broke out?
Well, when the initial outbreak happened within that late July, August 2015 period, we had a number of people that were susceptible and fell ill to the Legionella, and including staff. And so there were 12 that perished at that time, that died from the Legionella. So the remedial measures were taken within 3 weeks' time after knowing that we were dealing with what bacteria. When it was identified within 3 weeks, the outbreak was quashed, and then we immediately started treating the water differently. And by 2016, I think we heard today that the Capital Development Board explained the water treatment that is in place now. And so there was a death last fall, the 2013, and the CDC was called back in. The CDP, Center for Disease and Protection, came back in and recommended some more remedial treatments. So I don't know, Mayor, have you?
Yeah, I think what's sometimes being lost in this conversation is that over $6 million of investment was invested at the Quincy Home to treat this. The CDC or CDP was invited back.
When was that, Mayor?
That would have been the year following. I believe it was 2016 when it was all implemented. 2015.
You're asking what?
The $6
Well,
million.
basically, some people are going to say that
2016.
the remediation has taken too long.
No, the
And,
water
I mean,
treatment.
that's what Mr. Pritzker is basically pointing fingers at the governor, saying, these people died because he was asleep at the switch, so to speak.
Well, immediately there was emergency water treatment changes put in place within that 3-week period that we just talked about.
Could you go closer to the microphone?
Within that 3-week period that we just talked about in 2015, remedial emergency water treatment was changed and put in place. Now, the building of the permanent water treatment was finished in 2016. That's a $6 million investment. So, obviously it took time to build, but we definitely took remedial water treatment immediately. The water tower was cut off completely that sits at the Quincy Veterans Home, and the city of Quincy helped us facilitate new systems to pump in from a different direction the water. So, as he said, $6 million was invested by 2016 based on recommendations. And I think we heard today from the Capital Development Board and Director Jeffries that quickly Brick of Belleville was hired to implement that water treatment system.
So, Senator, can you, either of you, shed any more light on what Director Jeffries said today, that one of the ideas under study is a construction of a new facility? I mean, what details do you know about that?
Well, I mean, certainly that is one of the recommendations that since we still are testing, and to make it clear, not every facility or nursing home or hospital tests like we do at the Quincy Veterans Home routinely. They have continual testing for this, and so you will find positive tests. And so ideally we'd like to eradicate and have zero testing. But I think, as all the public health people will tell you, that you will still find positive tests.
Do you have any idea whether when she talks about that, are we talking about just like a whole new complex or a new building?
Yes.
And do you have any idea
Yes.
kind of in terms of the expenditure there? Are we talking what? Any idea how much that would cost?
Well, I think the Capital Development Board is putting that together. We've been kind of briefed on that, but yes, that was some of the things to recognize that once everybody has agreed that we need to maintain the home, it's serving veterans very well in this area, and they love it there. The veterans groups that visit there, the families, everybody is so supportive of remaining and keeping this home, and or campus, if you will. But so I can't tell you exactly. That would be a question for the Capital Development Board. But yes, I think the governor stayed there that week and mentioned that he thinks that the best way to go forward is, using that water treatment plant that's in place, but building some new facilities there. There's a Kent that had been closed, Kent Hall, and there had been plans by CDB to revamp it and put veterans back in there. But I think we're recognizing that better practices that knowing what we know at this point would be to build a new facility.
The state hasn't had a capital bill in a long time. Is this going to have to be part of a capital bill, or is it going to be run separately if that's the choice?
Well, we have our Senator Durbin has been there. Congressman Hood has been there. Senator Duckworth is scheduled. And, of course, I visited the home with her when she was Director of Veterans Affairs. So they are supportive of keeping the home there, and I'm hoping that's what Senator Duckworth will determine, that we need federal match. We need federal funds. And so that's very much from our federal legislators. We're hearing from them that they might be able to help and assist.
And if you guys addressed this already before coming in, do you have anything to say about the tone of that committee hearing today? It seemed to delve very deeply into
we mentioned
politics.
that. Politicizing some of this events does nothing to help serve our veterans. We want to work in a bipartisan fashion. I think overall, you saw most of the House representatives and the senators, regardless of party, want to do the best by our veterans. That's the focus, is to have a home that best serves our veterans. So, yeah.
Yeah, I made note of a couple things during the hearing, and several of the people who made some comments, who I noticed who had not visited. As I mentioned, I thanked the senators and representatives who have taken the time to visit. Several of those comments that I thought were more politicizing, and they had not visited the campus yet. So they'll be getting a follow-up invitation from my behalf to come and get them on hand and let them see firsthand what's going on there. And I think, as far as the rest of your question, any type of a responsible and good long-term plan is going to include perhaps new building. It doesn't necessarily say, yeah, we're not done until we do build a new building. Well, a long-term plan encompasses a number of different things, and we're going to take intermediate care of the water facility as we continue to invest in that with more filters, et cetera. We're going to look at perhaps using some of the existing facilities like the Kent building, and maybe trying to get the dollars to revamp that, or possibility as a responsible plan, we need to look at the potential of a new building as well. And then to go the step further and asking about a capital bill or capital plan, this would take priority over all things. We have lives at stake, and we have veterans at risk. So let's put that first and foremost in front. It doesn't have to be a complete and comprehensive capital bill. We can do a capital bill that would include taking care of our veterans at our veterans' homes in Illinois.
Let me throw out a series of questions, some basic information. So we got the veterans home. How many veterans are there? How many people are employed there? Is it funded entirely by the state? Do the feds put in money? And if we build a new building, do we know a number on what that would cost?
Well, let me state that it is a 200-acre campus, and it includes a fishing pond, it includes a cemetery, it includes a deer park. I mean, it's many, many different buildings. Domicilaries are there that have like 11 cottage-type units. They call them the cottage. So it's kind of hard, if you've visited some of the veterans' home, this is a very unique place and campus. It's very sprawling and beautiful. It has old buildings, it has new buildings. So it's a mix of different buildings when we talk about certain ones. But so there are 350 residents, and it varies a little bit because unfortunately we're dealing with an aging population, and about 15 veterans die per year.
Is there a waiting list to get in?
Yes, sometimes. Well, especially in the Alzheimer's, they have an Alzheimer's. There's 6 or so levels of care there, and so definitely in the more skilled Alzheimer's unit, there might be a waiting list. 500 plus employees work there, and so it's very large compared to other veterans facilities in that regard. And so a new building, again, it depends on the size, which building we might replace, because there's several skilled nursing units there. I mean, in different buildings.
At this point, we don't know what the capital cost would be. Would the feds put in any money, or is this?
Yes, and you also ask, it is an Illinois veterans home, but yes, there is federal match for the care of veterans. A care of a veterans nursing patient is different than a care of a private nursing patient.
Can I ask a follow-up? There are several bills that have been thrown into the hopper, both in the House and the Senate, relating to all of this. And I guess I'm sort of curious, being from the Quincy delegation here, whether you favor or oppose or don't know enough about some of these things. I mean, the first one is this notification issue that in the event of an outbreak, that there be a 24-hour notice to families and to staff and the like. Do you guys favor, not know enough about a concept like that?
We're still. As I said, there's going to be a series of hearings. I think sometimes we do knee-jerk reactions and throw something out there. The 24-hour notification, it may fit some circumstances, but not all. I think we heard today that I thought Dr. Shaw did a good that first you have several questions to know. You have to answer those questions before you just do a blanket 24-hour notification. I mean, that's protocol within the national healthcare system. Or anywhere that's following the protocol of the CDB.
And I think from a community standpoint, you don't want to cause unnecessary panic in a community. You've got to learn what the root of the cause is. As was said in the hearing today, you have to know if this is site-specific incident or if it's community-wide incident, and more importantly, how are you going to deal with it? And so from a community standpoint, you don't want to cause unnecessary alarm in a community as a whole. And so I think in this instance, we need to be very careful about putting, mandatory timelines on things because it could have unnecessary effects for the community.
But what about in terms of the family? I mean, they're your constituents as well. I mean, some of them that we talked to said that had they known that this was prevalent there, that they might have pulled their family members out.
Well, actually, after it was made, I think only one person chose to leave.
Well, what about also
and many of the families who are suing now have said that they are supportive of the staff of the veterans home and feel like the staff did handle their loved one in a proper and professional manner. So again, yes, the families, you need to notify them, but if I'm a family member, I'm going to want to know, one, what's the plan of action? And if the plan of action hasn't been developed yet, then sometimes maybe it wouldn't be the necessarily thing to let them know if you don't have a plan of action. And that's what the director said today again at the hearing, that sometimes you need to know A and B, but you also need to know C, D, and E, how you're going to deal with A and B, and I think that's important.
A couple other legislative initiatives that are in play as well, lifting the Court of Claims caps, and then also getting the Auditor General involved and doing a kind of a forensic deep dive into all of this. What do you guys both think of that?
Yeah, I guess I would just say no comment because I haven't even seen those bills. A couple of them I just was made aware of this morning at the hearing.
Senator Tracy, do you have any opinion about those two?
No, likewise, it's early in the session. I haven't had a chance, but with that, we'll conclude our session. Thank you very much. Appreciate it.